Did you know when you turn 65, you are allowed to enroll in Medicare but not take Social Security? Hi, I'm Larry Goist, owner of LMS Insurance Group, where we help seniors navigate the Medicare Maze. So in today's short video, I'm telling you guys about your coverage options when you're 65 and you're offered insurance from an employer. And I'm going to go over three real basic topics. So in today's short video, I'm explaining to you guys your options for health insurance coverage when you're 65, but you're also offered insurance from an employer. And I'm going to go over three real basic topics today. So number one, I'm going to tell you the things that you have to avoid doing to avoid penalties at 65 when you have group health insurance. Number two, I'm going to compare employer group health insurance to Medicare plans. And then number three, I'm going to give you some examples of when you should drop your employer group health insurance and enroll in Medicare. And that's all coming up next. Hey, before I dive in, don't forget to like our channel. Definitely subscribe if you find this helpful. I really appreciate you doing that. Okay, so let's start by discussing some important rules that you have to follow when it comes to employer health coverage when you turn 65 if you want to avoid penalties when you do enroll in Medicare. So the first thing you should know is you could only delay Medicare without a penalty if you are getting group coverage from active employment. So if you're offered health coverage from a retiree plan, you have to pick up Medicare A and B to avoid a penalty. So the only way to avoid Medicare at age 65 is if you have coverage from active employment. Now, that coverage could be from you actively working, or it could be coverage from your spouse that's actively working. Okay, now if you work for an employer that has less than 20 employees, you have to pick up Medicare A and B at 65. Because if you don't pick up Medicare A and B, that small group health insurance would no longer cover you. So the rules are different depending on the size of the employer. If you work for an employer with 20 or more employees, then theoretically you could delay Medicare at 65 without penalty, but there's a few more things you need to know. So if you find yourself in that situation where you're offered coverage from a large employer, 20 employees or more, you also have to make sure that that coverage is considered credible coverage. Now, credible coverage would be defined as coverage that meets or exceeds the coverage that's offered by Medicare. Now, that's a pretty vague statement, and that's something that you don't have to figure out on your own. In fact, under the Medicare Modernization Act of 2003, employers are required to notify you whether your coverage through your employer is considered credible or if it's not. And they are required to notify you when you turn 65, and then also annually each year they have to notify you and let you know if that coverage is still considered credible. So if you work for an employer, 20 employees or more, and you are offered coverage from active employment, you or your spouse, and that coverage is considered to be credible, then theoretically you can delay your Medicare and you don't have to worry about penalties down the road. Okay, so now let's compare employer coverage to different Medicare scenarios. And keep the understanding that every employer plan is going to be different. So these are just examples to kind of bring this to life. And again, I do want to preface that, remember guys, if you are turning 65 and you don't want Social Security, you could still take Medicare. So you could take Medicare at 65 and you could delay your Social Security all the way till age 70. Remember, those are two separate decisions. One is income, Social Security. The other is health insurance, Medicare. Okay, so when we're comparing, let's start with deductible. So again, these are all going to be different depending on who your employer is and your plan. So I'm just giving you some averages. So as far as deductibles go on group health insurance plans, in 2024, according to the Kaiser Family Foundation, the average deductible on a group health insurance plan was $1,787. So on group health insurance plans, the deductible average nationwide was almost $2,000. Okay, what about a Part C Medicare Advantage plan? Now, I couldn't find hard data on how many Part C Advantage plans offer deductibles. So what I did was I went to Medicare.gov and I just looked in the county that I live in. So in Trumbull County, Ohio, 11 of 74 Medicare Advantage plans had a medical deductible, so less than 15%. And it's also important to note that of all the clients that we've helped, very few of our clients are enrolled in Part C plans that have deductibles. We give them the other plans. So I couldn't find exact data, but in Trumbull County, Ohio, that number's around 15%. 15% of Medicare Advantage plans had some deductible, while the overwhelming majority had a $0 annual deductible. Okay, and if you go on Medicare and take a supplement, a Medicare Supplement Plan G, your deductible would be $257. So again, group insurance, the average $1,787 deductible. Medicare Advantage, usually no medical deductible. Medicare Supplement, a $257 annual deductible. Okay, when it comes to dental and vision, on almost all employer health insurance plans, you're buying your dental and vision separately. If you look at your bi-weekly or your weekly check, you're going to have a deduction for medical, dental, and vision. So you're buying all those things a la carte. Now, on a Part C Medicare Advantage plan, all of those things are normally included under one roof. So you're going to have all your benefits under one plan with one card. And then on a Medicare Supplement plan, you're going to buy those things all a la carte. So if you want dental and vision, just like the group health insurance plan, you're going to pay for those things separately. Okay, what about monthly price? Well, the monthly price on an employer plan, again, it's going to be different for everybody. I talk to people that pay $50 a month. I talk to other people that pay $400 a month. So that's going to be really more specific to your unique situation. Okay, on Part C Medicare Advantage plans, all-in cost, you're going to pay anywhere from $10 a month to $185 a month. Because the Part B Medicare premium is $185. However, over 30% of Medicare Advantage plans offered in 2025 offer a Part B rebate. So the insurer is actually paying your Part B Medicare premium for you. So depends on where you live, but again, it's fair to say that you could pay as little as $10 a month all in for Medicare Advantage, or you could pay the standard price of $185 a month. Okay, and on a Medicare Supplement, your all-in price is going to be anywhere from $250 to $350 a month. Because with a Medicare Supplement, you have to pay for Medicare Part B, which is $185. You have to buy your supplement, which could be $100 to $150 a month. And then you have to buy a Part D drug plan. So the supplements, you're going to be $250 to $350 a month all in. Okay, what about having to stay in a network? So on an employer plan, yes, you're going to be in a network. It's either going to be an HMO or a PPO, but generally you're going to get cheaper prices if you stay in a network. Medicare Advantage plans, exactly the same. You're going to be on an HMO, you're going to be on a PPO, you're going to get the lowest costs if you stay in that plan's network. And then finally, on a Medicare Supplement, which is also called Medigap, there are no networks. You can go to any doctor or any hospital that accepts Medicare. Okay, what about the most you could pay in the year for health insurance? Well, that's called your maximum out-of-pocket. And on group health insurance plans, it's going to vary. I've seen maximum out-of-pockets as low as $1,000, but I've seen maximum out-of-pockets as high as $10,000. So each plan is individualized and your unique situation needs to be analyzed. Okay, on a Medicare Advantage plan, according to the Kaiser Family Foundation, the average maximum out of pocket in 2024 was $4,882. So on average, you would have almost $5,000 in risk in the calendar year on a Part C Advantage plan. Okay, and on a Medicare Supplement Plan G, your maximum out of pocket is going to be $0. Once you've met your $257 deductible, all other services are paid at 100%. And you probably noticed in the chart that was more expensive, right? You're paying $250 to $350 a month, and that's because you have no out-of-pocket costs after you've paid your $257 deductible. Okay, what about these extra benefits? Gym memberships, over-the-counter benefits, things like that. Well, typically on employer plans, those types of things aren't offered, although I have seen employer plans now start to give you credit for doing X amount of steps a day, doing certain things like that where you can earn reward money, or you could earn discounts off your monthly premium on your plan. Okay, when it comes to Part C Medicare Advantage, these are the plans that are going to include all the extra benefits. Over 98% of Part C plans offered have a gym benefit. Over 50% offer some sort of over-the-counter allowance. So the Part C Advantage plans is where you're going to see the extra benefits included in one plan under one roof. And then on a Medicare Supplement plan, you're not going to get those extra benefits. If you want a gym membership, anything like that, you're going to pay for that usually out of your own pocket. Okay, so now that we have a high-level overview of employer coverage versus Medicare Advantage versus Medicare Supplement, I want to give you guys some examples of when you should absolutely drop your employer health coverage and enroll in Medicare. So the number one reason would be if you don't want to hear the word network and you don't want to hear the word prior authorization. Look, every employer health plan in the world requires prior authorization. If you want to avoid prior authorization, you could go with Medicare and a Medicare supplement, and you won't have to hear that word anymore. Reason number two is that you want to lower your deductible. Look, the data is there. The average deductible on an employer plan in America is over $1,700. Medicare Advantage plans rarely have a medical deductible, and Medicare supplements have a $257 deductible. So if you want a much lower deductible, you would drop your employer plan and you would elect Medicare. Okay, reason three is maybe you want a lower monthly price. Now look, I've seen employer plans where the employer pays the entire share. And in that case, you can't get a lower price. But on Part C Medicare Advantage plans, we have real examples of people that pay $10, $20, $30 a month all in for their coverage. That's dental, vision, doctors, hospital prescriptions, all wrapped up in a Part C Medicare Advantage plan that has a Part B rebate that pays part of your Medicare premium for you. So if you want to lower your total monthly cost, Medicare Advantage plans with a Part B rebate will probably do that for you versus an employer plan. I would say the last reason that you should seriously consider dropping your employer coverage and going on Medicare is because you have already paid for this for 50 years. And if you look at your most recent pay stub, you're still paying for this, as they are withholding Medicare and Social Security taxes every time you get paid. But at minimum, you should at least do the due diligence and compare your group health insurance to the different Medicare options. And more times than not, people get confused, so they do nothing. So I was really enthusiastic about making this video because I want to make it clear. Group health insurance is great for certain people, but there are a lot of instances where you can drop your employer coverage, you can get better benefits, lower premiums, lower deductibles, and get more extra benefits. Now, this is going to be a case-by-case decision, so you should always work with a professional, whether it's an insurance broker, somebody at your state health insurance assistance program, or us at LMS Insurance Group. If you need more information, go ahead and check us out on our website or use the information in the description below, as me or somebody in my office would love to help explore these options. Guys, I'll talk to you next time. Larry Goist, LMS Insurance Group.